All right, today we're talking about something that sounds like it's straight out of a sci-fi horror movie, but it is all too real. It's called sepsis, and it's what happens when your own body, trying to fight off an infection, turns on itself and launches this just devastating attack on its own tissues and organs.
I mean, think about that for a second. It's this terrifying paradox, right? Your immune system, it's supposed to be your ultimate protector. It's like this highly trained army inside you, ready to take on any invaders. But with sepsis, that army goes completely rogue. It just turns all of its powerful weapons inward. So how on earth does your greatest protector become your worst enemy? Let's get into the science and figure it out.
Okay, so here's the official medical definition, but let's just break it down into plain English. The key part here is that phrase, dysregulated host response. All that really means is that your body's reaction to an infection, it's just not controlled anymore. It's completely out of balance. It spirals out of control, and all of that chaos leads to organ dysfunction. And that's just the clinical way of saying your organs start to shut down. So, to really wrap our heads around sepsis, we've got to look at what's actually happening inside the body on a biological level. And honestly, the best way to think about it is like a full-blown civil war.
Okay, so what we're looking at here is the huge difference between a normal, healthy fight and a catastrophic one. See, normally, when you get an infection, your immune system is smart. It launches a really targeted, localized attack. It sends the troops right to where the problem is, they fight the germs, and the inflammation stays put. But in sepsis, that response isn't localized at all. It's like every single alarm bell in your body goes off at the exact same time. You get this massive, body-wide inflammation. It's not a targeted strike anymore, it's total war. And this internal war, it usually plays out in two phases. First, you have what's called the hyperinflammatory phase. This is the big one. It's a massive inflammatory storm, just a flood of these chemicals called cytokines that cause damage everywhere, and that's what leads to organ failure. But, and this is wild, right after that all-out assault, the body can swing to the complete opposite extreme, the hypoinflammatory phase. Basically, the immune system is just exhausted. It's totally suppressed, which leaves the person wide open and incredibly vulnerable to getting even more infections.
So the science is fascinating, but let's get to the really critical part. Knowing what's going on is one thing, but actually recognizing the signs in someone you love or maybe even in yourself, that is what can literally make the difference between life and death. So let's talk about the red flags. What do you need to look out for?
And believe me, the stakes here are incredibly high. A recent study found that sepsis had a staggering 22% mortality rate for patients who got sicker in the hospital. I mean, think about that. That's more than 1 in 5. This is a true medical emergency, and that's why speed is absolutely everything.
Okay, so these are some of the absolute key red flag signs to watch out for. We're talking about things like a sudden change in mental state, like brand new confusion or just not being all there. Or a heart rate that's just soaring over 130 beats a minute. Maybe their breathing gets really, really fast, like 25 breaths a minute or more. A big drop in blood pressure, that's another classic sign. And even look at the skin. If it looks mottled or there's a rash that doesn't fade when you press a glass on it. Seriously, if you see any of these signs and you know there's an infection, it's time to get medical help immediately.
All right, so as soon as sepsis is even suspected, a clock starts ticking, and you have to move fast. Luckily, the medical community has a plan, a rapid-fire counterattack designed to stop the body from destroying itself, and it's called the Sepsis 6.
And this is the battle plan. It's called the Sepsis 6, and it's a bundle of 6 steps that have to be done within the first hour. It's broken down into a really easy-to-remember format. Take 3 and give 3. So doctors will take 3 things: bloods to check on organ function, cultures to figure out what bug is causing the infection, and they'll monitor urine output to see how the kidneys are holding up. And at the same time, they give 3 things: oxygen to help out struggling tissues, IV fluids to bring that low blood pressure back up, and absolutely crucially, IV antibiotics to start fighting the actual infection.
And the impact of this? It's just astounding. Get this. Just doing these 6 simple things within that first hour can cut the risk of dying from sepsis by more than half, more than 50%. It just goes to show, with sepsis, every single second counts. Recognizing those red flags and acting fast, it literally saves lives. It's that simple.
But you know, even for the people who win that initial terrifying battle, the war isn't always over. Surviving sepsis, well, that's often just the beginning of a really long, really difficult road to recovery.
This aftermath has a name. It's sometimes called post-sepsis syndrome, and it can be absolutely life-changing.
a lot of survivors have to deal with major changes to their physical abilities. And then there's the psychological trauma. We're talking anxiety, depression, even post-traumatic stress disorder. On top of that, organs that were damaged during the fight might never get back to 100%. And to top it all off, survivors are actually at a higher risk of getting sepsis again down the road.
So why is this so important for every single one of us to know? Because sepsis doesn't care who you are. It can happen to anyone, any age, from any kind of infection. It could be from something as simple as a little cut that gets infected or a UTI. The single most powerful weapon we have against it is knowledge, just understanding the signs and acting fast without hesitating. That's something all of us can do. So it really comes down to this. Now that you know the science, could you spot it in time?